You know, millions of Americans deal with mental health problems, you know, whether either themselves, you know, or they have a family member that does. Well, today on the show, we're talking at Gulfport Behavioral Health with Loyal Onus, who is the Chief Executive Officer. How are you, sir?
Great. Thank you for having us.
So it's good. I appreciate you being here during Mental Health Awareness Month. Give us some statistics, if you would, about dealing with mental health.
Well, I think the first and most important is that 1 in 5 people, and actually for adolescents, it's 1 in 3, deal with mental health concerns. In America, we spend nearly $1 trillion a year dealing in lost productivity because of mental health issues.
Wow. I mean, that's a lot. A lot of people don't wear it. I mean, you may look at somebody and think they're just fine, and they may not be. And of course, that's why behavioral health here is here to help people out and dealing with those things. I mean, look at the suicide rates. I mean, they're high.
Suicide rates have always been high and are increasing. Since the pandemic, suicide rates are up. Emergency room visits are showing that 1 in 8 emergency room visits are related to mental health and/or substance abuse issues. 22 veterans a day die by suicide, and there's over 120 deaths every day in this country alone due to suicide.
Where's the starting point? People to talk to someone that they feel might have some behavioral issues.
Well, I think the starting point is to tear down the stigma around mental health and the recognition that it's prominent, it's out there, and that literally every single one of us deals with mental health concerns. So the more we can normalize it, the easier it is for us to have a conversation about it and make it part of the conversation.
And of course, with all the dealings that we've had over the past couple of years with COVID, that has really put mental health issues off the charts.
COVID has just ramped it up. Even as COVID is continuing to decrease and the pandemic is continuing to decrease, we're seeing the numbers and the results from it increase. Adolescents in isolation and anxiety and now having to return to the classroom. Increase in bullying is a huge in our community alone.
Yeah. We're going to talk to Dr. Brian Gaddy now and find out more about the impacts that these different things have on individuals. Dr. Brian Gaddy is the medical director here at Gulfport Behavioral Health. Dr. Gaddy, how are you, sir? Nice to meet you. Give us some impacts that COVID has had on individuals and their mental health that they're having to deal with. I mean, kids too.
Well, sure. I think that the past few years have been very stressful for a lot of people, whether it's grief from loss, the stress that comes from physical illness. You know, in the medical field, we've known for a long time what stress can do to our bodies, but also our minds. Mm-hmm. And this has just been a reaffirmation of how things that get kind of out of control, especially what stress can do and how it affects depression, anxiety, how things manifest in children like that. And one other thing that we've really seen issues with is the uptick in alcohol use, drug use, people trying to cope with all these issues, and we basically have lost 30 years of progress on the improvement we've made in alcohol use.
Has it changed the way that you do treatments or therapy in mental health?
Well, I wouldn't say it's changed the way that we do it, but I mean, we've definitely seen an uptick in people that need our services. Mm-hmm. Our approach has always been, it's good to first name the problem. Name what the issue is, and sometimes that's hard to do, but if you're able to name the problem, then you can address it, Mm-hmm.
Well, I know there's so many wonderful things that y'all are doing here at Gulfport Behavioral Health Center here on Highway 49 in Gulfport. There's so many different people that we need to talk to, and we're just going to be able to scratch the surface here. We're going to talk to the Director of Clinical Services now. Arlen Lang is the Director of Clinical Services here at Gulfport Behavioral Health. How are you? Pleasure to meet you.
It's nice to meet you. It's a pleasure.
Give us a little background, if you would, about the services that you provide, whether it's inpatient, outpatient, that you work with your clients here.
Certainly. In our inpatient, we are blessed to have a minimum of 5 groups a day, 7 days a week. These groups are facilitated by our experienced clinicians and staff. We offer different modalities in the inpatient setting. We offer psychoeducational groups. We also cognitive behavioral therapy groups. And we also have added different type of modalities such as yoga and pet therapy.
Aww.
Here in the near future, I know we're so excited, and in the near future we'll be having gardening therapy as well. And one of the benefits of group therapy is that our patients are able to communicate with their peers. In their process, they're learning social skills, and also they have that ability to share with others what they're going through, their own experience, and others can also listen and compare to what they're also challenging at, challenging times at these moments.
And I'm sure that each one is going to be worked with on an individual basis depending on their needs.
We also, absolutely, we do have individual therapy, which is slightly different. That is a one-on-one setting, and one of the benefits is the confidentiality aspect, and that is that we provide a safe environment for the patient to share their individual problems. So it is a more intense, but most importantly, patient-centered treatment.
Thank you, Ms. Lang, for sharing that with us. It's been a pleasure. Now we're going to talk to Stephen East, who's the Director of Business Development here at Gulfport Behavioral Health. Stephen East is the Director of Business Development. How are you? It's good to see you again.
Good to see you again. How are you doing?
I'm doing great. We've talked to several different people about some of the wonderful things that you have going on here at Gulfport Behavioral Health. Give us kind of a summation, if you would, and how to get in touch with you if they need your services.
Okay, well, Gulfport Behavioral Health is an inpatient facility, and we help with crisis, but we also have some outpatient services such as partial hospitalization and intensive outpatient. Now, our partial program is for adults, and our intensive outpatient is for adolescent and adults. If you need an assessment, we're here 24/7, 365. That assessment is no cost to you. That gives you a level of care where you might fit. And to do that, you can call 800-831-1700 and make an appointment, or you can walk in the door and say, hey, I need an assessment.
Need some help.
Yeah.
I need some help. Or you can also go to gulfportbehavioral.com. There's a lot of great information on there.
And we do also have a contact sheet there. But just realize that those things go through all the servers and everything, so it may take a while to get to us.
Right. So they could go in there and fill out something online.
That's correct.
And submit it. And then
one of our assessors will give you a call and give you resources that you might need or ask you to come in.
All right, Stephen, thank you so much to see you.
Thank you.
If you are in need of some services, or you know of someone that needs some services, for mentally or they're having some emotional problems, they definitely will take care of you here. They are located on Highway 49 in Gulfport. They are Gulfport Behavioral Health.